Hello there and welcome. We'd like to take the opportunity to thank the teaching team for their time today. We are excited to present our work, which we have titled Labored Breath, Confronting the Toll of Chronic Lung Diseases in Coal Mine Workers of the Appalachian region of West Virginia. This proposal is intended for the Federal Mine Safety and Health Administration. The state of West Virginia has chosen to adhere to federal mining regulations and has not adopted specific state code. Therefore, we have chosen to present this to the federal agency because they have the greatest direct impact on the regulation of West Virginia mining operations. Let's start digging for context. Why West Virginia? As you can see in figure labeled 12, the highest rates of COPD mortality in 2008 were primarily clustered among the southern and central counties of West Virginia. Age-adjusted rates ranged from a high of 127.9 deaths per 100,000 population in Mingo County to a low of 34.6 in Hardy County. To understand the concern of high death rates from chronic lung diseases among Appalachian West Virginia coal miners, several key points need to be addressed or understood. First being the prevalence of chronic lung disease. Coal miners in Appalachian West Virginia have significantly higher rates of chronic lung diseases, such as black lung disease, chronic obstructive pulmonary disease, or COPD, and cilicosis, compared to the general population. This is largely due to prolonged exposure to coal dust and silica particles while on the job. Secondly, occupational hazards, including the harsh working conditions in coal mines, including inadequate ventilation and insufficient protective measures, increase the risk of inhaling harmful particles, leading to long-term lung damage. Next is the economic and social factors. Many coal miners in this region work in the industry due to limited economic opportunities, and the coal industry has a deep-rooted cultural and economic significance. This complicates efforts to implement stricter regulations or transition workers into other industries. Lastly, health disparities. The region faces significant health disparities, including limited access to healthcare, high poverty rates, and lower educational attainment, which exacerbate the impact of chronic lung disease. These factors also make it challenging for miners to seek preventive care or early treatment. This leads up to the importance of public health policy. By understanding these factors, policymakers can develop more targeted and effective interventions to reduce the incidence of chronic lung diseases and improve the overall health outcomes of coal miners in Appalachian West Virginia.
This graph depicts the increasing percentage of coal workers' pneumoconiosis based on the tenure of working in the coal mines. Coal workers' pneumoconiosis, aka the black lung disease, presents as significant and worsening problems for coal miners in Appalachia, West Virginia. These conditions arise from long-term exposure to dust and diesel fumes in the mines, causing permanent lung damage, disability, and even death. As you can see from this chart, based on the tenure, as the tenure increases from the 0 to 9 years to 25, there is an increased prevalence of coal workers' pneumoconiosis throughout their surveillance period from the 1970s to 2014. This slide shows that the age-adjusted rates for COPD mortality in comparison of West Virginia to the US, and we can see a significant increase in the deaths per 100,000 population. The seriousness of the problem of COPD in West Virginia is evident from the mortality rates depicted in these slides. In 2006, the age-adjusted COPD mortality rate in the state of West Virginia was 54.8 deaths per 100,000 people, significantly higher than the national rate of 39.3%. From 1999 to 2006, West Virginia consistently has higher COPD mortality rates compared to the rest of the United States. The situation worsens in 2007 and 2008, reaching a peak of 68.5 deaths per 100,000 people in 2008, which is an increase of 19% from the previous year. West Virginia experiences the highest rates of COPD in the nation, with a prevalence of 13.9%. And other respiratory illnesses such as asthma and lung cancer have higher prevalence rates as well. These rates are highest amongst adults aged 55 to 64 years old, less than a high school education, and a household income of less than $15,000. There's almost 25% of the population that is also addicted to nicotine, which ranks second in the United States for prevalence. Even though there are high rates of respiratory illnesses in West Virginia, the coal mining industry produces results of higher respiratory illnesses seen commonly among the coal miners. 9.2% of the West Virginia population reports either current or past employment in the coal mining industry, which results in about 13,962 individuals who are working in the coal mining industry in 2018. West Virginia is also the second largest producer of coal in the United States. The coal mining industry is present and abundant in the Appalachian region. West Virginia is a major player of coal industry in the U.S., and the West Virginia coal miners are also at increased risk of occupational exposure secondary to the coal mining dust. There is also a difference in the types of dust when comparing surface mining to traditional underground mining. The exposure to silica dust from the surface mining increases the risk of respiratory illnesses. Coal workers' pneumoconiosis, or also known as black lung, is the common respiratory disease encountered by coal miners, but its more severe form, PMF, which is progressive massive fibrosis, is increasing in prevalence. A federally funded black lung clinic is established throughout multiple states in the U.S. to assist coal miners with their lung disease. In relationship to occupational exposure, the most common is concerning the inadequate safety standards in West Virginia coal mines that has contributed to the rise in these chronic lung diseases. This is related to three main areas. Number one, regulatory gaps. While regulations exist to limit coal dust exposure, enforcement has been inconsistent, and silica dust, which is more harmful, has not been adequately addressed in the past. The Mine Safety and Health Administration has been criticized for not having stringent enough standards and for the following loopholes that some of the miner companies can exploit. Number two, inadequate enforcement. There is skepticism about the enforcement of existing rules. Even when new regulations are proposed, such as stricter silicon dust limits, there is concern about whether there will be effectively implemented, given historical challenges in regulating mine safety. And lastly, industry practices. Some miners have reported that they are pressured to manipulate dust samples to hide overexposure, which undermines efforts to protect workers from harmful dust. This graph portrays the recommendation of exposure limits, or the REL, related to the NIOSH recommendations, and compares it to the Mine Safety and Health Administration permissible exposure limits related to the respiratory silicon crystals. This can lead to higher evidence of lung disease characterized by lung inflammation and scarring that can be progressive into the more severe form of known as PMF, or the progressive massive fibrosis. In June of 2023, the Mine Safety and Health Administration has coming up with new proposals that are going to decrease some of the permissible exposure limits for the RSC.
So given all of this context, what does this mean? Our identified problem statement is that Appalachian West Virginia coal miners have higher death rates from chronic lung disease than the general public. So what can be done? In this next section, we're going to explore the policy alternatives our group has identified, beginning with the status quo. When we talk about maintaining the status quo, this involves allowing the ongoing rollout of Mine Safety and Health Administration regulations without additional reinforcement or support. As mentioned earlier, some of these major regulation changes occurred in 2023 and 2024. This approach focuses on resource management and aims for a streamlined implementation of the existing regulations. The key elements include continuing with the current implementation process, utilizing existing support systems, and periodically assessing the rollout of these regulations and their effectiveness. Adjustments could be made as necessary based on the assessment's findings. Next up, we'll look at our first policy alternative, which is policy alternative number 2, which centers on air quality monitoring systems. Requiring mining companies to invest in advanced air quality monitoring systems involves several key elements, including implementing real-time data reporting directly to the Federal Mine Safety and Health Administration, and imposing penalties for noncompliance. The purpose of this approach is to address health risks, enhance compliance, and improve oversight of air quality in mining operations. Implementation steps include mandating the installation of monitoring systems, establishing real-time reporting mechanisms, enforcing compliance through penalties, and providing support and training to ensure effective use of the new systems. Policy alternative number 3 showcases the importance of dust suppression technologies. Requiring the use of dust suppression technologies to reduce exposure to respirable crystalline silica involves key elements such as implementing specific dust suppression technologies and establishing enhanced maintenance standards to ensure that equipment is maintained over time. The purpose of this approach is to reduce health risks, set standards for the equipment utilized in dust control systems, and ensure their compliance and longevity. Implementation steps include specifying the technologies to be used, setting maintenance standards, enforcing compliance, providing support and training, and continuously monitoring and evaluating the effectiveness of the measures. And finally, we'll move into policy alternative number 4, which has a focus on education. Developing a robust educational campaign aims to inform miners about their individual rights under the new Mine Safety and Health Administration rule on respirable silica dust, as well as other critical health and safety regulations. Key elements of this initiative include creating an educational campaign, focusing on individual rights, and highlighting key health and safety regulations that impact miners. The purpose is to empower miners, improve compliance and safety, and enhance the impact of regulatory measures. Implementation involves designing and launching the campaign, engaging stakeholders, evaluating and adapting the campaign as needed.
In the next section, we will identify the evaluation criteria we use to define success in program implementation. When comparing our alternatives, we evaluated them against various criteria. Evaluation criteria are crucial because they provide a structured approach to assess the impact of the policy in achieving its intended health outcomes. These are some of the criteria that we systematically compared and evaluated. Effectiveness. To evaluate the effectiveness of our health policy aimed at reducing chronic lung disease among Appalachian West Virginia coal miners, we considered whether it leads to a decrease in incidence and mortality rates. We assessed whether the policy promotes adherence to safety measures and improves health monitoring, enhances access to healthcare services, results in economic benefits such as cost savings, increased productivity, and we also evaluated the policy's adaptability and sustainability over time. Equity. To evaluate the equity of our health policy alternatives, we considered whether the policy provides equitable access for all miners and reduces health disparities. We evaluate whether the policy ensures resources are fairly allocated to those in greatest need, and that diverse miner groups are represented in the policy development. Additionally, we examine the policy's impact on vulnerable populations, including older miners and those with pre-existing conditions, to ensure they benefit fairly. Employee adherence. Employee adherence to the health policies relies on several key factors. These include awareness and education about health risks, the availability of proper protective equipment, as well as a strong workplace safety culture. Economic pressures such as job security concerns and trust in health and interventions also influence adherence. Additionally, support systems like health monitoring play crucial roles in ensuring the success of policy alternatives. Feasibility. Evaluating the feasibility of the health policy alternatives involves assessing political support, including stakeholder backing and alignment with existing laws. We also evaluated the feasibility, such as economic factors, including cost effectiveness and available funding, administrative feasibility, which allows an organization to evaluate whether the policy can be sustained over time. These are crucial factors in determining the policy's practicality and likelihood of success. On the next screen, we will outline projecting the outcomes, taking into consideration the criteria we use to evaluate the policy.
The purpose of this section is to elaborate further on possible outcome scenarios. What should we expect from each possible policy action? Elaborated in the table on the screen is our 4 options: status quo, advanced air quality monitoring systems, dust control suppression technology standards, and education of miners. The criteria we have used is weighted in the scale above: effectiveness, 40%, equity, 20%, employee adherence, 20%, and feasibility, 20%. We have scored each appropriately based on a low, medium, and high context, with low getting 1 point, medium 2 points, and a high of 3 points. In our combined scores, we see that the status quo, nothing changes. Our score is 1. Under advanced air quality monitoring systems, we get 2.6. Dust control suppression technology standards gets a score of 2.2, and the education of miners gets a score of 1.8. In our next slide, confronting the trade-offs, we're going to discuss the whys behind this. In confronting the trade-offs, it is our goal to ensure that we are identifying the benefits and risks of each policy decision. In a perfect world, we would identify a perfect policy. This, however, is unrealistic. We must acknowledge the fact that each policy is going to have pros and cons. Under maintaining the status quo, no action is required. There's a low risk of failure. However, miners continue to suffer high rates of illness under current situations. Advanced air quality monitoring systems can detect need for air quality interventions, track and provide data on particulate levels, and provide a wealth of information. However, they're expensive, and just because there is information does not guarantee that action will be taken in all cases. Dust suppression technology improves air quality for miners, increases the equipment lifespan, and overall increase in mining safety. However, it is expensive again to implement and to upgrade current systems, and may take time for a majority of sites to engage. The education of miners is a more simple implementation and highly cost effective. It does not require advanced technology and reporting and can be immediately implemented. However, for education to be effective, it must be put to use. This relies on action of individual miners for compliance. Our recommended alternative is requiring mining companies to invest in advanced air quality monitoring systems that report real-time data directly to the Federal Mine Safety and Health Administration and levy penalties for mines that operate out of compliance. The penalties provide insurance that this will be complied with. And this is also one of our highest scoring policy alternatives. On the next slide, we're going to talk about some of the barriers and a bit further analysis into the whys behind this decision. Some of the barriers in this decision that we acknowledge is that infrastructure setup is going to take some time. And then it may not be compatible with new systems, which would require additional upgrades or modifications. There could be some pushback from mining companies or industry groups against increased regulation and penalties, which could delay and hinder implementation further. We also acknowledge limitations of our analysis. There may be inconsistencies in how data is reported and recorded, making it difficult to assess overall compliance accurately. Additionally, our analysis may lack detailed insights into the effectiveness of enforcement mechanisms backed by financial penalties and their impact on compliance rates for this industry. What we would suggest for future research is to study the prevalence of data manipulation occurring in the mining industry and study how the imposition of penalties influences compliance behavior and whether it effectively reduces air quality violations or not. Again, we thank you so much to our audience, the Federal Mine and Safety and Health Administration, as well as the teaching team for your time and attention today. The slides further are our bibliography, where we have cited our sources used in this presentation. Thank you.